to jump off.
Yeah,
So thanks very
absolutely.
much.
Absolutely.
Okay, so hello and a very warm welcome to ACT Essentials. My name is Joanna Taylor and I am Laura's business coach. I've been working with healthcare brands like Noi Group, La Pub Scientifique, Pelvic Pain Matters, Laura Rathbone for more than 20 years and helping them build businesses and communicate what they want to their desired audiences. And I'm absolutely delighted to be joined today by respected pain educator and my very good friend, Laura Rathbone. Morning,
Good
afternoon.
afternoon. Afternoon. Um, yeah.
Laura is a pain specialist clinician and mentor to healthcare professionals worldwide. She
Mm.
brings a unique perspective, combining cutting edge science with compassionate, inclusive practice. So, Laura, could you tell us a little bit about your current work?
Yeah, I am loving my job at the moment. I am a specialist physiotherapist by background. And I work psychologically informed in acceptance and commitment therapy. My current clinical role is as a consultant in pain to the pain team here in the OLVG hospital in Amsterdam. And that's where I see my patients. And then, in addition to this, I'm an educator and I'm also, recently part of the teaching faculty for Noi, where I teach graded motor imagery and explain pain. I'm an activist. I always found it quite funny to say I'm an activist, but I am for social justice in pain care, particularly in our healthcare systems, not just for patients, but for the clinicians who are working in that system as well. And with my friend Christine Petridis, I run Pain Geeks, which is an international journal club that's not only helping you learn how to read the evidence, but also giving you all those nudges and momentum and a community of support as you read it. So,
Yeah, it's a
yeah,
really
that's
fun, vibrant community, isn't it, Laura? Which you
yes.
and Christine have created.
Yeah, there's a few hundred clinicians on there from all around the world that are just like wanting to connect and, and I guess make friends and feel part of this bigger group of people that are committed to
Mm,
I guess reading really about pain, because that's what Pain Geeks is. It's a reading community. But at the back of that, it is about pain care. Yeah.
yeah, fantastic. So this is the second session in
Mhm.
our ACT Essentials series, and
Mhm.
today Laura will be introducing the Hexaflex, the visual model at the heart of ACT therapy. So if you've done an ACT course with Laura, this will help to refresh you and reinforce your understanding of the framework. But if you're new to ACT, this session will give you an idea, a foundation for understanding how the model works. So we're going to be exploring the six core processes and how they work together to promote psychological flexibility. And at the end, we'll share details about Laura's upcoming ACT course, which starts in February 2026. So if you're interested in learning a bit more about that, just hang around at the end and
Mm.
we'll share those details with you. So Laura's going to be talking for about 20 minutes. Let's kick off.
Ah!
Yeah, keep it short, Laura. Come on, think condensed. Okay. So let's start with the basics. What exactly is the Hexaflex and why is it central to ACT?
Oh, I love this question. I will try and keep it short. But the Hexaflex basically is just a visual model of how we're understanding people's sort of what they're struggling with, first of all, but also like how we can move them forward. So how we can stay inside the sort of the psychotherapeutic framework of ACT. It's really interesting to me sometimes because we often call ACT like a modern approach, but it always makes me giggle a little bit because it's not at all a modern approach. So like actually acceptance and commitment therapy was came first, and then the Hexaflex came about sort of 10, maybe even 15 years later. So
Mm,
it's the Hexaflex is kind of the modern way of thinking about it compared to its earlier days. But it was first introduced in 2006. But acceptance and commitment therapy itself is much older than that. So Stephen Hayes started working on this in like the 80s. So
Mm,
it's not a modern approach in the sense of it's like in the last 10 years. This has been going as old as I like for 40 years. Um, so yeah, but before it became acceptance and commitment therapy, it was called comprehensive distancing, right? Which is also really
okay.
interesting. So at the heart of what we're doing in acceptance and commitment therapy, it's about recognizing that we are experiencing thoughts, feelings, rules, unpleasantness, but we are also able to distance from that and observe those things. We're not necessarily in it and under it. We're able to observe that. And in that sort of stance, that observation stance, there's space for making choices about how you live. So the Hexaflex is called the Hexaflex because it's 6 processes that
Hmm.
underpin or feed into or support this thing we call psychological flexibility. Um, so yeah, it's a way of visually like modeling what we're doing in acceptance and commitment therapy, but it also has multiple functions. So one is that it's not a linear graph. So it's modeling to people who are learning ACT that this is something we're doing in a sort of complex real-time approach in the
Mm,
moment.
mm,
Um, and it also allows people to stay connected to the work that we're doing, which is fundamentally different to how cognitive and behavioral therapy or even traditional behavioral therapies have sort of developed as in their approach. So Hexaflex is both a way of like say like showing what ACT
mm.
is, but it's also modeling ACT in itself, which I think is quite clever.
It's really clever, like really clever. Like
I
two
know.
level, isn't it?
Yeah, but this is what I like about ACT is that it's not a superficial sort of protocol to therapy.
Mm,
It's really got depth to it. So as you start asking more questions to it, you find yourself in like behavioral learning theories, and then you find yourself in philosophy, and then it just gets deeper and deeper. Yeah.
mm. Fantastic, thank you. Really interesting. Would you give us an overview of the 6 core processes, please?
Yeah.
For
So when we say the
Hexaflex.
6 core processes, in your mind, you have to hear psychological flexibility. Right. So psychological flexibility is the overall direction of what we're trying to, the overall skill that we're trying to sort of promote, support, facilitate in the person.
Mm,
And the 6 core processes are how we sort of operationalize that. Yeah. So, but ultimately, if you're seeing psychological flexibility, you're probably seeing changes in all of these 6 core processes, whether you can label them or not, right? So in the middle of it all is psychological flexibility. And then the operational process is the way you're going to sort of create and curate your therapeutic decisions in clinic will sort of come around contact with the present moment, which is a kind of like it could be considered mindfulness. It's being psychologically present and aware. So in the current moment, so acknowledging that you might have a tendency or we might have the capacity to spend time in our past or spend time projecting and imagining our future. But in this moment, we're going to stay right here, right now, in this sort of second to second awareness. Then
hmm.
we've got acceptance, which I find quite a tricky process with most people. They find that word very loading. But if I slightly flip that word into willingness, so being willing to have or to sit with or to acknowledge um,
Mm,
that there is unpleasant internal experiences. So we're talking about things like feelings, thoughts, emotions, sensations, memories, past events, things that you've been through, experiences um, and that they are
mm,
present with you, even though they are unpleasant. Yeah, and acceptance is a kind of forward motion with that. There's a sort of willingness to say, yes, I am a person who experiences these things, even though I judge them negatively, maybe, right? So, like, for example, jealousy. I am a person who can experience jealousy. Um, that's just part of being human, right? So there's that kind of element
Mm.
to that process. And then if we go down into the model to sort of cognitive diffusion, or psychological diffusion, this is being able to take that observer stance on those things as they come up, on those internal experiences as they come up. So, noticing that you are a person who experiences jealousy, then being able to see
Mm.
yourself experiencing it in the moment. Oh, there's that jealous feeling. Oh, what does that mean? And sort of be able to observe that and ask questions and be like, oh, look, there it is. And that's kind of what cognitive diffusion is. It's this space taking, it's this observational
Mm.
process. And then if we keep moving around, I'm trying to be quick, as you can tell. Like
Okay.
thinking about self as a context. Now, I love this because this is where we get existential, right? You are a human being that has been on the planet for however many years you've been here, and that forms the context of how you experience your moments, right? So and it allows us to ask this question, well, who am I?
Mm.
And maybe even notice when you overly identify with one element of your identity. For example, I might say, um, I don't know, I'm a jealous person. I don't know why. Jealousy is coming up today, but like I might
It's a
say,
good
oh,
one.
I'm just a jealous person, right? I'm just a jealous guy. Is that Paul Simon?
No, it's not.
Anyway,
Oh, come
I've got it
on.
in my head now. Um, but yeah, so I might overly
Mm.
identify with that. And that might be, and if I don't observe that very well, that might start to form the basis of how I move through the world. But I'm much more than just a jealous person, right? I'm much more
Mm.
I'm able to experience much more than just jealousy. So can we widen out that sense of who we are? Can we acknowledge that, yes, there are these things about us, but there's also these things about us, and take that again, that sort of um, this is where we talk about exposure to the self. So we're sort of giving people the skill and the moment to acknowledge and be present with who they are as a person over time, which
Mm.
includes all of the things that you've been through, even the bits that you think, oh, I'm so glad Facebook wasn't around for that. Like that's also still still part of you, right? It's still who you are.
Yeah,
Never
totally.
disappears.
And I think this is one of the things, and we did talk about this last time we did a
Yeah,
live, that ACT is just like being human.
it
It's
is.
just, it is, there's so
Yeah.
much humanness in it, and it's so
Yeah.
relevant for
Yeah.
not just treating your patients, but for you as a person, as a human being, and being able, as a human, to
Mm.
go through the same sort of experiences and feelings that you're actually facilitating your patient to go through
Yeah.
is so powerful.
Yeah.
Just think
Absolutely.
so
It's
much more
necessary.
relatable. Yeah, like
Yeah.
it is next level, isn't it? It's really
Yeah.
next level.
And then there are two more sub processes that sort of really bring this round into a full system. So we have like being able to commit to your values. So like knowing what you value, and this is really where we start
Mm.
thinking of activism in terms of morality and like what does it mean to you to live a good life, right? So we start getting into those sort of
Mm.
moral conversations that it's not social morality. There's no system for that. It's you as an individual. What are your values? What is it to you to live a good life? What are the things that you stand for? What stance do you want to make decisions about your life from? Um, and then we move into committed action, which is this sort of action taking in line with those values.
Mm.
So you have these six processes, and in the original work, in the 2006 work, Stephen Hayes does sort of say, like, you've got the sort of cognitive change on this side, and then you've got the sort of behavioral change on this side, which is why it is a cognitive and behavioral approach, but it
Mm.
isn't. sort of CBT in its sort of more conventional sense, because we're not trying to change any of the unpleasant experiences. We're working on accepting and embracing that they are part of your day-to-day life.
Mm,
And we want to change the function of those experiences on how you live your life. Yeah.
mm. Yeah, fantastic. Thanks. That's so interesting, Laura. Talk about this for hours. So you that's six distinct processes. How do they interconnect with each other?
Yeah. So I think this is, and we're going to talk about this a bit later, I think, but I think this is one of the common mistakes is that people then say something like, and this is not a criticism, but six distinct processes. They're
Mm,
not. They're like, so they Hayes talks about them as being
mm,
pragmatically delineated, but not ontologically delineated, right?
mm,
So, like, what is ontology? Ontology is the branch of philosophy that's studying like fundamental truth, the fundamental nature of what it is to be. Right. So we can pragmatically talk about these six processes as being, kind of contained within their sort of operation,
mm,
but really they're not separate at all. If you're
mm.
working on one, you're working on the other, and that's why when you look at the hexaflex, all of the lines cross over
Yeah.
because it's not like you can just work on values. Like you might do a values based session where you're focusing on values activities. But if somebody's connecting to their values, they're also connecting to this wider sense of who they are. They're starting to commit to those values, just even in linguistically, they're saying these are my values. That commitment
Mm,
process is building. They're sort of diffusing from maybe the thing that brought them into your office or into your room, which might be pain in my example. So they're sort of stepping back from that. They're noticing pain is there. They're allowing pain to be there in that
mm,
acceptance approach. And then in the moment, starting to try and really connect to who they are. And so they're not necessarily separate and they're not delineated,
mm.
but they are pragmatically separated so that you can do it. And that's important, right? Because if you understand these as distinct processes, you might try and implement them in a linear way.
Yeah.
6 weeks,
Yes.
six processes.
Yeah.
Yeah. And I think there's a lot to be said for that. Like, I'm not critiquing that. It's just that it's not happening like that. Pragmatically, that might be what you're saying, but that's not what's happening in reality.
Mm,
Um, these are all not necessarily not just intertwined, but they're enmeshed. They can't function without the other. You can't get improvements in being able to commit to your values if you're not seeing changes in acceptance. Um, that's the idea anyway.
mm.
So this model sort of is this kind of like container for all of that psychological process that's happening in the person. And I'm not even sure psychological is the right word. I think embodied, it's an embodied process, right? I mean,
Okay.
everything we do is embodied, but we're really working on that
Okay.
identity and existential part of what it is to be human. Yeah.
So you have mentioned psychological flexibility about several times. What exactly is it, and why does it matter? Psychological flexibility.
Yeah, so psychological flexibility is about being able to stay in contact with the present moment so that you can either continue with or stop a way of being in the world or a behavior or an action
Mm.
that is not workable in supporting you to have a sort of a good life, right?
Right.
So what does that look like? So if I might say have a particular rule about what it is for me to experience an internal thing. So, for example, I might have a rule around jealousy. Like when I start to get all of those feelings in my system that jealousy is there, I start to get the sort of the narrative of jealousy coming through. I might then start to act in a way that tries to get rid of that or to solve that
Yes.
problem. And I'm thinking about, trying to control the actions of somebody else, maybe, or trying to find out and prove whether my jealousy is right or wrong, or something along those lines. And that might actually not be helpful in the way that I want to be as a partner, as a person, as a friend, as a communicator, as a human in the world. And so, can I be flexible enough with my own rules and habits and urges and sort of practiced actions to say, oh, there's the urge to do that thing, but actually, I'm going to choose to do this differently. I'm going to choose
Mm,
to behave in a way that promotes a sense of trust or a sense of self-belief or a sense of self-ownership or whatever it
mm,
is that you want to work down. And this can be quite helpful in pain. Um, and it really comes from this sort of relational frame theory that the more you focus on the sort of the experiential network, the psychological network that the person has scaffolded around a particular experience, the bigger you make that network.
mm,
So when we're trying to
mm.
focus on psychological flexibility, we're saying, yeah, there is that thing, but let's move over to this way of, that you want to be. Let's put effort and energy and attention onto things the kind of person that you want to be, the kind of responses to the world, behaviors in the world you want to do, rather than putting attention on the thing you don't want to do. Because all
Okay.
that does is make it bigger. A bit like if I say, don't think about an elephant, you immediately start thinking about an elephant.
Yeah.
Right? So, so instead of saying don't think about an elephant, I could say start thinking about a giraffe. And now
Yeah.
the elephant is kind of gone, right? And now you're onto something else. So that's what we're trying to do with psychological flexibility. We're moving and shifting where you invest attention into growing the parts of yourself that you value.
Okay. So, could you give us a clinical example of what psychological flexibility looks like in pain practice?
Yeah. So, I mean, a really great example would be if somebody comes in with the rule that, like, say they want to, say you have a patient, and I've got a particular patient in mind right now, and probably the people watching this either live or on record can also think about these patients where they have this rule that pain needs to be gone in order for me to do the valuable activity,
Yeah.
right? So I'll do that when my pain is gone, I'll do those things. And we recently had a talk with a young woman who is in this situation, in this sort of delay defer pattern when it comes to pain. Because she's not
Mm,
allowed to do those things when pain is there. That's the rule. Pain is somehow a thing that needs to be done privately, separately, in an isolated way, not
yeah.
out there in the public for everybody to see. And so what we're working on is on allowing pain to be there, um, and moving towards the things that are important. So what does psychological flexibility look like? Well, it's any shift in that person towards breaking the rule, right? And that
Mm,
might be very subtle in some people. Even just thinking, allowing the thought experiment in. Maybe I could go to that concert, even though I might have to sit down a lot, or I might have to have special breaks, or I might have to do it in a different way to how I would normally do.
yeah.
Even just thinking about that can be that sort of very small sliver, very subtle shadow of the beginning of taking behavioral change, right? And action change. And that's the important thing because
So,
otherwise
sorry.
they miss out on that, right? And a
Yeah.
life constantly missing out on things, that's where the distress is. So in an acceptance and commitment therapy model, what we're saying is that all
Mm,
the distress that comes from being someone that's living with pain or depression or anxiety is in the conflict of not being able to express your values and your sense of self in the world.
so, psychological flexibility is allowing them to do meaningful things, even with the discomfort.
Yeah. And it's interesting because we as clinicians still fall into the sort of habit of, and does that somehow cure the problem? Does that take the discomfort away?
Mm, mm, mm,
Because we want it to get easier somehow. But the reality for many people living with these, whether it's a psychopathology or whether it's chronic pain, um, Yeah, no, it might be just continuing to live with this struggle.
Yeah.
Because one of the things that our evidence does keep showing us is that we don't have great ways of curing these things, these experiences when they become part of somebody's life, right? That's
Mm.
not necessarily something that we can do. I think it's very important that we continue to hold reducing these negative experiences as part of our overall goal, if that's
Mm.
possible. But I don't know if we can. And so,
Okay.
how do we live better with it?
Okay. Fantastic. Thank you. Thank you, Laura. I'm just conscious of time, so I'm just gonna ask you to so we've looked at that. And how can therapists start to recognize these processes in their clinical work?
Yeah. So, I mean, I think one of the first things is it feels difficult in the beginning because you're going to have to learn a new language in a way, right? So, you're going to have to sort
Mm.
of start playing with the words, like thinking about acceptance, avoidance, thinking about values. Like these are quite, these might be quite new depending upon your professional background. So, if this is new to you, like spend some time just with that, with the processes, trying to understand a little bit of what they are. And probably you'll
Mm.
start to notice either in yourself, in other people, or in your patients that you start seeing these things as they're coming through. And I think one of the important things about ACT is that it comes from a position of human experience. Like when you say this is very human, it is very human because it's not been invented, it's been observed, right? Psychology isn't invented,
No.
right? It's it's
Yeah.
not like somebody sits down and is like, oh, this is psychology. Like they observe people. So we observe people doing well, we observe people doing poorly or in a sort of self-reported way or maybe in an observable way, and try to figure out what is it that's happening there. So what is it when people are doing well and what is it when people are not doing well?
Mm.
And then systematizing that, operationalizing that, and that's psychotherapy. It's just what we observe in a sort of way of doing it in a container. So like try and I always think it's really, really helpful if you spend time noticing it in yourself first. Now, whether that's
Yeah.
in yourself as a human, walking around your room, your world, or whether it's specific to clinical practice, notice when you find that you're starting to feel that internal conflict, when you want to avoid, when you don't, when you're starting to turn away from maybe things that are valuable for you in clinic, but because you're starting to have an internal experience of like, oh, maybe this person is going to get angry at me, or maybe this person, maybe I'm letting this person down, or all
Mm.
of those internal judgments that we make. That's what we're focusing on. It's not avoidance of activity, it's avoidance of this internal stuff that we don't like.
Mm.
So notice that and then see what happens. Just let it breathe, let it grow, let it percolate, see what comes out of it.
Fantastic. It's fascinating. Thank you. Juliana says, I'm a dentist. Is it possible for me to apply these concepts with chronic pain patients?
Oh, I love it when a dentist comes to town because yeah, so first of all, I love that because you know, I think to be a dentist is really difficult, right? And people are often in states of distress when they're in your chair. And I'm speaking from my own personal experience because I absolutely am freaking out in that chair.
Dentist.
I'm like, ah, I don't like this. And it's an awkward thing to do, isn't it? I think it absolutely translates. So ACT isn't about chronic pain, it's not about physio, it's not about psychology. It's just about how we hold our own distress and how we hold space for other people to hold their own distress, right?
Yeah.
So like I think this is a very relevant I guess, stance, way of being in practice for dentists. I think for all clinicians, I think we can do this well. And I think what you might find, so when I'm working with medics, so when I'm either supervising medics or whether I'm therapist, I sometimes use ACT slightly differently.
Mm.
So when we're working with therapists, we're talking about developing a whole therapeutic pathway and how we're going to hold that person go through this transition, this transformational work. Medics don't necessarily have therapy training, and dentists, I sort of class in that kind of spectrum as well, although that might be my own ignorance, and I'm always happy to be updated on that. But I think you don't necessarily sit there and plan a therapy process for someone's anxiety or fear or pain when it comes to the dental work. But what you can do is you can develop your ability to hold and sit with and support someone as they go through distress in that moment. And so you might think of it less as a therapeutic process for the person and more as like a therapeutic support as an adjunct. So like therapy informed medicine is what we're sort of working on in the pain teams. Like how can I be a therapy informed medic without having to be the therapist? Um, and I think dentistry could absolutely benefit from that. And I think you'll
Mm.
find that you are able to support someone to, yeah, change their relationship with their experiences when they come into your seat. I think so.
No.
Lovely.
Yeah, thank
Um,
you. Thank you.
yeah.
And what a great question. Thank you for joining us, Juliana. That's fantastic. So we're just going to wrap up now.
Yeah.
So Laura, we've covered a lot
Yes.
today. This and thing is, there's so much here, and it's just so fascinating on so many levels. I've done your course, and I really loved it. And I'm not a medic or clinician, and as a human being, I loved doing the ACT course. So,
Lovely.
for anybody that would like to go deeper, can you just give us a brief overview of what your ACT course does cover? It's coming up in February 2026, I believe.
Yeah, so you can get more information on the website. But the ACT course is it's quite condensed in terms of contact. So it's 12 hours of contact, but it's across 4 weeks. So there's it's like, and the way that I teach is very much in a sort of flipped classroom experience. Like I want you to go and sort of play with some of the material so that when we come into the space, we've got content to work through. But we're going to look at sort of the history of ACT, the sort of underpinning theory of relational frame theory, how that might support you in developing your relationship with ACT as a clinician. And then, of course, we're going to be working on some of the on how do we hold clinical space for these processes? How do we guide people through developing a relationship with their values and holding that? So it's really um, it's both theoretical and it's sort of practical and it's applied. But the thing that I love the most about teaching ACT is the feedback that I get from patients, from clinicians that say,
Mm,
this has actually just changed how I do my job. Like I am more able to hold the burden and to hold the distress. I'm not burning out as much. I'm able to hold my own values much more in
yeah.
clinic. So I think it's somewhere, it's like part therapy, part teaching, part like I don't know,
It's
practical
up
skills
levels people.
application approach. So yeah, I think that's what I would hope people expect. And what I love also is that people make friends, right? Like people build communities, and then often people join Pain Geeks, and then you start to feel part of this wider community. So
Yeah,
yeah.
amazing. Yeah, absolutely amazing. It is a fantastic course. I think it up levels people as humans.
Or maybe it helps us to realize that we're already doing a really good job and we don't need to keep
Yes.
up leveling. We can just
Yeah.
celebrate the fact that we are perfectly imperfect, struggling humans doing our
Yeah.
best. And yeah, that's also enough, right?
Yeah.
Because
Yeah.
remember,
Helps you to
psychological,
notice.
right? Like psychological flexibility isn't just about helping people do things differently. It's like to persist or stop, right? So
Mm,
persist with stuff that you're doing really well that's working for you, and stop with stuff that's not working for you, right? That's
mm.
that's really all it is, and that can be really powerful.
Thank you. So thank you, Laura. Thank you for everything that you've shared with us today. If you are interested in Laura's course, the details are on her website. It starts on February the 3rd, 2026. So check that out. All the details are there. And we hope this has given you a clearer understanding of ACT core model.
Yeah.
There will be another live session in 3 weeks' time, I think, something
Yep.
like that.
Yep. We're on a
So keep an
roll.
eye out for that, and do do come and join us again. We'd love to have you. Thanks ever
Yeah.
so much to those people that joined us live today. Thank you for your time, and we hope to see you again soon. So
Yeah.
thanks a lot. Take care, everyone.
Thanks. Bye.
Bye.